Welcome to the Elaborate Topics podcast, where we focus on lab-specific strategies for medical laboratory professionals. We're proud to be the healthcare detectives that work behind the scenes to get the results needed to influence medical decisions. Let's grow together and jump right into the lab.
Hi, friends. Welcome back to this episode of Elaborate Topics. I am your host for this episode, Tywana Wilson. Hopefully, you have been checking out our library of episodes. We have 200 episodes in our library. So if you have been under a rock, make sure that you go to Direct Impact Broadcasting or your favorite podcast platform and check out the library of episodes. I'm sure if there's a topic that you want to hear at some point, I am sure we have probably covered it. So go on over and check it out and make sure that you share this episode out. Don't be stingy. Sharing is caring. Myself, along with my co hosts, Lona Small and Stephanie Whitehead, would greatly appreciate that. And if you have any feedback, please reach out to either of us, and we would love to hear your thoughts, your takeaways, or if you would like to be a guest on this show. So, without further ado, we have a fan favorite. We have an Elaborate Topics favorite guest. I feel like this young lady has been on here at least 3 times over, and probably more than that, actually, over the past 4 seasons. But this time is extra special because now I get to introduce her as Dr. Dana Powell Baker. So, Dr. Baker, how are you?
Yes, I am great. I feel like I'm an alum of Elaborate, you know? This is awesome. I'm glad to be back.
Well, you are official. You are a true Elaborate supporter, and we are happy that
Yes,
you
indeed.
continue to answer the call and share your knowledge with the listeners.
Well, thank you so much. I'm always honored to be invited back into this space, and it's like a homecoming, if you will. So I'm excited to be here. Thank you.
Well, we are going to get into this episode. And what's pretty dynamic and special about this is Dr. Powell Baker has recently assumed a new leadership role. She's currently serving as the president of the Society of Black Pathology. She's the inaugural lab professionals president for that particular not for profit organization. So it's exciting to be able to talk with her and learn more about that organization and the work that her and the group are doing over there. So before we get into talking about the SBP, which is the Society for Black Pathology, Dana, you want to tell the listeners a little bit about your lab journey and how did you become the first lab professional to hold the prestigious title of president for the SBP?
Sure. Happy to do that. So I always like to start with that. It wasn't a journey that just everything came together overnight. It's definitely been a process and a almost a trajectory in building up to the opportunities that I feel really blessed to have recently and currently in regard to even my current role as president for the Society of Black Pathology. But if I go back to my foundation or my roots, if you will, starting out as a medical laboratory scientist, as that was my undergraduate major. Well, at that time, medical technology, which of course that has changed. Um, but um, but starting out, graduating from that program, receiving that clinical training and experience really set the stage for what my career path has evolved into. Very early on, if I think back to even all my like clinical preceptors and trainers that I had on the bench, um, especially those that look like me, other Black women that were laboratory professionals. I would say they sowed, sowed the seed really early on and just really empowering me to always seek opportunities to grow and evolve. And so it's something that I've always had in mind and in my heart that I would have the opportunity to and responsibility to become a leader, but it was just a matter of when that would happen. Not realizing now in hindsight that, we're always leading. You don't have to be necessarily in a leadership role to be a leader. And so whether that's leading by example in your training of other students and performing competency assessments of other personnel, which that was all the things that I did earlier on in my career. I always embraced any opportunity to expand my skill set, I would say. And so when I look at transitioning from different bench positions or even different laboratory environments, I was also always, I would say, I would really thread throughout all of that experience my interest in training others and being part of that training and development for other professionals. And in doing that, it also encouraged me to actually seek out those opportunities to be involved with professional organizations. And I was in a talk earlier where I was posed a question about, if you're in a laboratory setting where the leadership team has been that set team for a number of years, how do you evolve or transition into a leadership role? And even if you are in a current setting where it doesn't seem like that opportunity exists, as I was in that similar situation, that's where I sought out the opportunity to get involved with professional organizations. So getting involved with ASCP or even ASCLS, just starting out as a volunteer, not taking on a leadership role initially, but maybe it was just doing outreach as an ambassador or being a member of a committee that was interesting and intriguing to me. But through the course of doing that work and people, really others, just recognizing my gifts and my talents and encouraging me to step into a role that may have more responsibility. So whether that's chairing a committee or leading a council or eventually even being a part of board of directors work, I said yes to all those opportunities, and through that developed a leadership skill set that also just aligned with what I was doing professionally. And so moving from, I would say, the lab into the classroom, becoming an educator, and then now as a manager for academic partnerships, where I get to merge my experiences, not just in the clinical laboratory environment, but also from the academic setting into the work that I do currently, plus all that leadership experience that I did throughout those different volunteer roles, really just all, I would say, just come together, just merge together into the work that I do now. And so when I look at my current, I would say, opportunity as serving as president for the Society of Black Pathology, it was still just being open and saying yes. I was approached about, just being a volunteer with the organization, and through just gaining more understanding and learning more about their mission and what they're hoping to achieve as a society, I said yes, I'd be happy to contribute my skills, my knowledge, and so forth to the work of the organization. And so transitioning from just member to volunteer, then serving as secretary last year, this opportunity then evolved as far as serving as president. And so just you know having that faith and trust in me to step into this was really empowering and encouraging. And again, I'm just honored to be able just to serve the organization in this capacity.
Wow. Dr. Baker, it's always interesting because I've known you for some years now and you've taken on a lot of leadership roles. Do you ever get nervous or scared about saying yes? So I heard you say that you said yes to a lot of different opportunities, and many of the laboratory professionals that are listening to this episode are at that point where they're introverted and they're like, well, I don't know if I have all of the skills or experience, and they may be hesitant about saying yes. So, I, what made you say yes, even in some of these roles that you've taken over the years?
Sure. So one of the things I would say that's always stuck with me is that you have to be comfortable with being uncomfortable, and you find purpose on the other side of your fear. And so I will be very transparent that in anything I've done, even with 20 plus years in now in this profession and having the years of experience that I have in different capacities, I always get nervous. I always get anxious. And I know that just ties to my desire to want to show up and do my best and to fulfill the purpose or the mission of what I'm being asked to do. And I never want to disappoint people or fall short of the task. And so a lot of that nervous energy really comes from my desire to really wanting to be effective and to really sincerely want to make a difference and make an impact. And so would it have been easier for me to say no in some of those instances? Absolutely. As I was just listening to another talk today, no is a complete sentence. So if someone approaches you on something, you have every right to say no. Just knowing your own bandwidth and knowing what your capacity is, because sometimes we're just not in a space in life at that moment to step in or take on more. You don't want to ever overcommit and underdeliver. And it's always daunting when you find yourself in that space of, am I overcommitting and underdelivering? But one of my favorite movies, and I've brought this up in other talks too, is Yes Man by Jim Carrey. And and ever since I watched that movie, it tickled my heart just watching it for the first time. But anytime I watch it, I just really tuck away that message of just saying yes. Because sometimes when you say no, you limit your own potential or just to see if you can. Or just you might limit your opportunity to even grow. And so you never know what you're going to discover on the other side of that yes. And so I always think back to that movie and think of just how quickly his life evolved. I know it's a script. I know it's make believe, but I just think the foundation and the core of that message just strongly resonated with me. And so I always have that in mind, that if I say no, what am I, that fear of messing out kind of thing. But with that being said, you also have to be strategic in your yes. And so really, really, again, just thinking about your capacity, your bandwidth, and what you're saying yes to. And I mean, I know you would be on the same page with me that just over the years, some of the opportunities that you and I have said yes to have led to things that we would have never, ever imagined for ourselves.
Absolutely.
If you would have asked me before, what was that, 2022, that, hey, someday you're going to be shaking hands with the former First Lady of the United States, I'd be like, there's no way I'm going to meet Michelle Obama. And then
Mhm.
where were we, Tawana? We were right there,
On the front row.
front row. And then we're right there shaking hands and taking photos. And it was so surreal in that, again, I'm like, I would have never. And just people just thinking about the things that you would never imagine or fathom for yourself is oftentimes going to be on the other side of that yes. And so that's why I encourage people, whether you don't have to be extroverted for all the opportunities that you may say yes to. You may discover things about yourself and actually even celebrate and be proud of yourself and be even more motivated to do more things and to step outside of your comfort.
Absolutely. And I could totally agree with you on that. It reminds me of Shonda Rhimes' book, The Year of Yes, where she made sure that she said yes to opportunities
Mm-hmm.
that were, of course, in alignment with her, but she said yes more than she said no. And you just never know where you might be. So I think that is very important for the listeners to know that, yeah, it's going to be scary sometimes, but
Mm-hmm.
if you feel like it's in alignment with your values and your core, and you have the bandwidth to do so, then say yes.
Take
We
that leap.
actually, yeah, we actually had an episode. Stephanie did an episode with Jennifer Becker, and it was called The Introverted
Yes.
Leaders. And if I'll link it in the show notes so that you all can go back and listen to it. But one of the things that Jennifer mentioned is that she decided that she was basically going to say yes and step up in some of these different opportunities, and to see her journey, of being an introvert and staying at an Airbnb during a conference because she was so nervous to meet people she had connected with virtually, but had never connected with live. But I
Mm-hmm.
think just her story along with what you are saying, Dr. Baker, is, very important for our listeners to know. So tell us a little bit about the Society of Black Pathology and the mission of the organization, because I'm sure many of the listeners might not have even heard of the organization before.
Right. And I am excited to share about this, for sure. But the Society of Black Pathology, originally named the Society of Black Pathologists. So we just recently underwent a name change, and I'll talk about that in a little bit more detail here in a little bit. But what started out as the Society of Black Pathologists, it was really 12 phenomenal individuals that came together and determined that there was a need for a society that just was really focused and dedicated to, addressing barriers related to diversity, equity, and inclusion, but really looking at how do we work to increase the number of Black and underrepresented individuals in the field of pathology. And them coming from their diverse backgrounds of experience, whether that was, at that time they were working pathologists or pathology residents, wherever they were in their journey, really spoke to the actual formation of the society. And so when it came together, they formed this nonprofit, again, just dedicated to addressing those barriers and with diversity and inclusion, and really seeking opportunities to really, I would say, speak to the needs of providing mentorship for those who are either in the profession already or emerging and evolving into the field, whether they need support in career development, leadership development, or leadership advancement. And of course, we would love to expand research in areas really more focused on advancing health equity and addressing healthcare disparities. And so it is a new organization again. We're in our fourth year, I want to say. So we're still growing, we're still evolving. It's been really supported with some great individuals. I commend again the founding members for this, and there's a few of the founding members that actually serve on the executive committee right now. So speaking to that sustainability for the organization and making sure that our mission remains at its core of really being committed to addressing barriers as it pertains to diversity, equity, inclusion. And I would even include belongingness as a part of that. And as we are talking about those who are underrepresented in the field of pathology and laboratory medicine, how do we foster that sense of belongingness in this workforce, and of course increase engagement there?
That's awesome. That is a pretty big task, but I think that is awesome that the organization is focused on addressing some of those barriers. Now, some of the listeners could be thinking, well, is it just focused on the professionals ourselves working in the field? Is it our patients? Is it both of some of the different focus areas that the organization is working on?
Yeah, I would say that our focus areas really speak to various aspects regarding that. So, although we are really looking to help increase or build the workforce through these pipeline efforts of expanding pathology and laboratory medicine workforce opportunities and just increasing the visibility and awareness of these career paths, we're also looking at, how can we help address health disparities and health inequities when it comes to our patients, especially those who are within marginalized communities and a part of underrepresented populations. How can our work and even our research help make a positive impact in how we provide patient care? But also looking at what can we do to support students and trainees, and so what scholarship opportunities may be needed, what type of mentorship may need to be provided to ensure that we are not just attracting and recruiting, but also retaining our future workforce and in that career path into pathology and laboratory medicine. And so it's not just limited, I would say, or restricted to just pathologists or just those who are working within the field of pathology and laboratory medicine, but we're looking at that full, I would say, continuum. If you're taking into account, not just people who are in the workforce, but those who are maybe entering the workforce or considering entering into the workforce, and also the patients that we're serving.
Got it. Now, I want to dig a little bit deeper into that and understand what does it mean for somebody to be a part of the Society of Black Pathology, and how could they even take it a step further? How could they utilize the membership or being connected or affiliated with the organization to contribute to their own professional journey? Because here at Elaborate Topics, we always say get involved, network, and so I'm thinking if there are those who are listening that, want to know more about, what does it mean to even be a part of it from a member standpoint, or how could I use this in my journey?
Yeah. So I would start with just thinking of my own journey in my career, and especially being a part of the laboratory medicine workforce for as long as over 2 decades now. I can't believe that. But in that, I just reflect on what did what did I need at different stages of my career, whether that was early entry into the field, when I needed or was seeking mentorship from people who had similar lived experiences to my own, or if I just needed a sounding board for something that I was experiencing on a job or in a position that I was previously working in, as there were different ones where I may have encountered even just discrimination or bias, and having what I felt like was a safe space, or a brave space rather, to have those conversations with people who had similar lived experiences to my own, who can really speak to that, to where I could kind of just think or talk it out. Like, is this gaslighting? Am I wrong in feeling or wrong in receiving this? How I received it or how I interpreted it? What would be the best way to approach or address this issue? Or what are some strategies that I can employ? Um, Maybe I'm overreacting in this instance. I don't know, or underreacting even. And so just being able to have what I call community, a community where I see myself, where I see others who have similar lived experiences to my own, to where I feel like I can have some of those more difficult or challenging conversations or discussions, where even there's an opportunity for accountability in that space. And I think really one of the top reasons why any one of us volunteers to join a professional organization is to identify or find that sense of community. And it's not to say that one organization is better for this than the other per se, but I really think it's more so important for at the individual level. Where do you go when you need to seek resources outside of possibly your employment, your school enrollment, or what have you, where you feel like you have community that could speak to the needs that you may have? And some of those needs may be couched in your identity, or um, or couched in that lived experience as a member of an underrepresented or marginalized group. And so that's where I say that SBP does come in into that space. And it's not just limited to those who identify as Black or African American. Yes, that's in our name, and that may be the primary focus of the organization. But we have members and even affiliates who represent diverse backgrounds, who support the mission and vision of the organization. And just through that, there's a shared understanding of why this space needed to be created, but also that collective goal and mission of what we hope to achieve together. And so that was really captivating for me in just recognizing the work that SBP was doing and striving to do, and really just being intentional in that, yes, we're calling it out. We recognize that there's a lack of diversity in the workforce, especially in pathology and laboratory medicine, and there's an opportunity for us to be intentional in addressing that gap, as well as gaps related to health equity, and what we're seeing as increasing healthcare disparities. Who's with us on that? And so for me, that was essentially a no-brainer that I wanted to get involved with that, contribute my lived experience, but also feel like I'm in a community that understands and can even empathize with my lived experiences as well.
I love that. I love having that community. I think it's very important as we talk about visibility and we talk about people not entering the field collectively as a laboratory medicine or pathology. It's very important to have that visibility and community for underrepresented minorities. Having also been in the field for 20 years, I will say finding that community is sometimes difficult, especially when you might be the only minority at some of the tables that you sit at. So having
Right.
that community that you can go to and bounce ideas from people that are at various levels of the organization or within the profession, I think is very valuable because sometimes as a lab professional, you might think,
Yeah.
well, maybe it's just at my level. But what I'm kind of hearing is that not necessarily, it could be at the pathologist level as well, or the administrator's level, and having that community of people to be able to bounce ideas off of. And it is very important. So I'm happy that
Yeah,
you mentioned
definitely.
that. As you were talking about membership in SBP, you mentioned that you don't have to necessarily be uh, African American or from an underrepresented group. So talk to us about the membership and how does one become a member? And just to clarify, you don't have to be a pathologist or anything like that, correct?
Correct. So, no, that's a good question. We get this question quite often, so I'm more than happy to address that. And so, yes, you don't have to be a pathologist, although it's awesome if you are. You could be a pathologist, you could be a laboratory professional, and even if you visit our website for the Society of Black Pathology, we have different membership categories, which really goes into detail the criteria for each category. And so if there are those kind of questions, those details are on the website. But we do have attending members. So that's one membership category, which is encompassing of both laboratory professionals as well as pathologists who have completed their residency training. And then we also have our affiliate membership category. So that may be for those individuals who don't meet the criteria for the attending category or trainee or even student. So this may be someone who is a vendor or someone who's external to the field of pathology and laboratory medicine, but finds identity and connection with the work that we're doing and wants to become an affiliate member. So that's an opportunity there. We also have the trainee membership. And so I do want to call this out. So both our trainee and student categories are free. And so our trainee members are those who are training within a laboratory professional program or they're training in an anatomic or clinical pathology residency or a subspecialty fellowship training program, recognizing that, our trainees and students need that additional support, but also opportunities to connect. So we don't want fees to be a barrier to that. And speaking of students, the fourth category, the student category, it's set aside for those individuals enrolled in a liaison committee on medical education or American Osteopathic Association accredited medical school. And so also student memberships are also open to those who are in NACLS accredited programs. So that's more so applicable to our medical laboratory or clinical laboratory science programs. And you'll see the other requirements there. So again, if you're a student, trainee, regardless of you're in a, let's say an MLT or an MLS program or in your pathology training or pathology residency, you have free membership options with this organization. And although there are fees associated with both the affiliate and the attending, I feel like those fees are nominal. They're not too expensive, or at least they're reasonable in their annual dues. And so definitely, again, if you have questions about, I guess, the specifics regarding those membership categories, we do have all that detailed on our website. And we also have a dedicated membership committee. And this year we have two co-chairs for that committee. And so any questions outside of what's described there, they can be contacted directly as well.
Awesome. So if somebody is wanting more information about membership, you could definitely go to the Society of Black Pathology's website, and I'll make sure that I link that here in the show notes so that you're able to secure your membership. Now, listen, let me tell you, and I subscribe to a lot of memberships with different groups, but to be a student or a trainee and to get a free membership, to me, that is a no-brainer. So if you are a student or trainee, or if you qualify for the affiliate membership or really a regular membership. So I am a member of SBP. This is my second year holding that membership. And so I would say if it's something that you are inclined or you feel like it's a fit for you, definitely make sure that you check out the membership. And I'm happy to know that it's open. I definitely wanted to clarify that for people because I know sometimes they look at some of these different organizations and they just look at the name and say, well, that's probably not for me without knowing more.
Right. And that was definitely the driving reason for our recent name change, as apparently we had people who would see the name, and because it had pathologists, they weren't seeing themselves as, being able to potentially join the organization or be a part of it, which is definitely not the case. And so, that essentially sent us back to the drawing board, if you will, of just having that open discussion about some of the feedback, but also what does the future of SBP look like? And it's, and us just being inclusive of both pathology and laboratory medicine professionals. And we felt Society of Black Pathology was just more encompassing and just more representative of the totality of our membership. So that way when you see the name, you see yourself in it too. And so whether you are a working professional or a student or a trainee in the field of pathology and laboratory medicine, again, you can identify with the organization all the way down to the name.
Think that's great. I think that definitely opens it up and it will make people feel included once they see that name. So I think that was awesome that you all were able to, look at what your members wanted and what the market wanted and go with something that was inclusive of a larger market. So I think that's great.
Absolutely.
Well, before we wrap up, is there anything that I should have asked you about SBP that I didn't ask you?
The only thing I will add is that we are, of course, actively seeking more members as we want to be able to grow the organization. We want to see it grow and thrive. And also with that membership, we also welcome additional volunteers. We have committees such as outreach, membership, even our program committee, and social media, if social media is your jam. We welcome those with just the strong interest and skills to and if you even if you don't have the skills, it's an opportunity to develop those skills, to volunteer and serve and share your gifts and talents and abilities with SBP. And so I definitely encourage you to visit our website, as our committees are listed there, and you can see our committee leaders listed there as well. So if you have more questions about the committee itself, such as, meeting frequency or expectations and so forth, please don't hesitate to reach out to us. And to also connect with us across all of our social media channels. So we are currently on LinkedIn, Facebook, Instagram. We just added Threads, so you can find us there too. And we are also still on X as well, formerly Twitter. So opportunity to connect with us and get the latest and greatest information about what's going on with SBP.
Awesome. Oh, one thing that I didn't ask is so it does the membership, is it calendar year or is it in tandem whenever I pay that I get a year?
Oh, that's actually a great question. This is something that we are discussing and exploring as a group, especially now with our new co-chairs on board. And so I would say regarding that in particular, I can have more concrete details about that shared at a future date, especially right now since we're undergoing some organizational changes or updates.
Okay, that's cool. Yeah, every organization is kind of different. Some are on calendar year and some are whenever you paid. And as you can see with me and these memberships, I don't even really know what all I paid for. But
Understood.
I
I'm in that same boat. Believe me, I am.
Well, before we close out, and I want to give you a chance to offer the listeners your, kind of leadership tidbits before we close out. I want to do something kind of fun, and this is not scripted, so hopefully it's not too painful for you. But I wanted to
Okay.
do something fun because we have so many, professional leaders on here that we don't always, get to see a fun side of you. So I hope you will humor me in my rapid fire. Are you
Okay.
game for that?
I am ready.
All right, Dr. Powell Baker, this or that, early bird or night owl?
Night owl.
Okay, yeah, I can see that. Digital notes or handwritten?
Digital.
Tea or coffee?
Coffee, definitely.
Conference calls or emails for quick decisions?
Emails.
In person meetings or virtual?
I love in person.
Formal presentations or informal chats?
Mm, that's hard. I give a lot of presentations. I enjoy the informal chats though. Yeah, let's go with informal chat.
And then our last one, podcasts or audiobooks?
Mm, podcast. I
Okay.
have to say
And
podcast. I'm recording for a podcast right now. Podcast.
great choice. Well, I like to have a little bit of fun. And sometimes, you get to see a different perspective of leaders, which is why I like to do the rapid fire questions. So hopefully that was fun for you, like it was for me. It's
Yes,
like I said, it's
absolutely.
interesting to hear different perspectives of knowing that there's no one leadership model and all leaders like different things, and that's okay.
Totally.
So as we get ready to close out, what advice would you give to other medical laboratory professionals who are also on their leadership journey and they're considering joining organizations such as SBP or other organizations in our profession, but they are unsure about how to be a part of these organizations? What advice would you give them?
Sure. I would definitely encourage you to join at least one organization, if not more. I know both between Taiwan and myself, we probably have a lengthy list of organizations we're a part of. Um, but it all ties into our areas of interest and, of course, aligns with the work that we do. And but I would definitely encourage at least getting plugged in as a starting point. Get plugged into at least one. And with doing that, just get familiar with the organization's mission and their opportunities for volunteering. And if it's overwhelming just to even kind of go through that list, if you're connected with other professionals on, let's say, social media, even, and you see some of the work or activities that they're involved in, send them a quick message. Just say, hey, what all does that entail? Or what do you do as a part of that committee? Or how do I get involved in that aspect of the work? So that way you could kind of get that informal chat, if you will, of the work that they're doing, and maybe that's what helps you get connected to a specific project or initiative. And then even if it's with SBP, for example, and if you're like, I don't know where I want to get plugged in, you can even reach out to me directly. I welcome that, as I often hear from people, even via social media, whether that's through LinkedIn or what have you, just asking or expressing interest, but also asking about, where can I fit in or plug in, and we can go over different options together. But with that being said, also make your make your interests known. Don't hesitate to share what you would like to be able to do. Because although I wish I was a mind reader, because I would get a lot of money for that, I'm not. And so I always tell people, let me know if you have an interest or if there's something that you see an opportunity for us to do that we're not doing yet. And maybe that's the opportunity for, a new committee or a new task force or an additional initiative that may plug in with something else or an opportunity to even collaborate to help establish that. So again, it's not a one-way street. It shouldn't always be you join an organization, now you do what we want you to do. We want you to feel motivated and connected to the work too. So if there's something that is currently not offered, and that's within really any one organization, offer up your idea because it may be something that may become a part of that organization's practice or part of their portfolio altogether.
That's great. Those are great points. And speaking of reaching out to you on social media or connecting with you, how can the listeners continue to follow you or start following you if they haven't been following you already and stay connected with you and what you're doing with SBP and everything else that you're doing?
Yeah, so I know earlier I listed all the accounts for SBP, but you of course can connect with me. I'm on LinkedIn, so even if you just look up Dana Powell Baker, I'm there. You can also connect with me on Instagram. I do have my account there under Dr. Dana P. Baker. I just changed the name of it, so I think that's what it's under now. As I was trying to update it, just in time for lab week and so forth. And so you can find me in those two. Those are the two spaces I'm the most active. I'll say that. Oh yeah,
Okay, so we'll make sure we link Dr. Powell Baker's contact info in the chat so that you can have her social media handles and get connected with her. If you are not on LinkedIn, because you all know that is the professional platform that we definitely push and want to make sure that you are part of, make sure that you uh, get an account over there as well. Dr. Powell Baker, this has been awesome. It's been great being able to talk with you and to be able to have you on the show post receiving your doctorate degree. So I'm
thank
excited
you.
to have you, and it's always great to hear your wisdom. You always
Thank
have something new, even though I've heard different presentations that you've done. I always get some nuggets that are new from you.
I appreciate it. I thank you for your wisdom too, and for all that you do. Thank you for being an inspiration and a role model, and then some.
Well, it takes a village, and I must say, I have a strong group of sister scientists that I am able to reach out to and get information from and pick their brains. You might know a few of them. So,
Absolutely, and that is so true. So true.
well, listening audience, our time has come to a close. I hope you were able to get a tidbit or two about Dana and about the work the Society of Black Pathology is doing. Make sure you go over to their website, check out what they're doing, get involved. If you feel like that is an organization that you want to be connected with, or reach out to Dana or any of the members on the leadership team for more information if you just want to know more. If you're a student or trainee, don't forget to claim your complimentary membership that's being offered. This is a way for you to get involved and start to network and cultivate your garden and grow your professional network and leadership skills. And make sure you continue to listen to this show week after week, share it out. We would be so grateful if you do so, and let us know what were your takeaways from this particular episode. So until next time, my awesome friends, I hope you have an amazing, amazing week.
Thank you for tuning in to another episode of Elaborate Topics, where your hosts discussed relevant strategies for laboratory professionals. Please subscribe to this podcast on your favorite podcast platform and listen to us on directimpactbroadcasting.com. Stay tuned for another episode with information you can use to excel in your laboratory career.